Welcome to the deep dive. Today, we're going to tackle something pretty interesting. Could hyperbaric oxygen therapy, HBOT, actually have a role in treating acute blood loss anemia?
Yeah, it's a bit of a surprising connection, isn't it? HBOT is usually linked with things like the bends or maybe problem wounds.
Exactly, but we've pulled together some material. There's a European Code of Practice, a hyperbaric medicine handbook, some medical resources on the chambers, and a text on HBOT principles.
Right, a good mix of sources.
And we want to explore if this tech, which basically floods the body with oxygen, could help when someone loses a lot of blood really fast.
So digging into the science and maybe some potential scenarios where it might fit.
That's the plan. See if we can understand the why and where without getting lost in, super technical details.
Okay, sounds good. So acute blood loss anemia, just to set the stage, it's basically when you have a sudden significant drop in your red blood cells because of bleeding, a big bleed.
And red blood cells are the oxygen carriers, right? Using
Yeah.
hemoglobin.
Precisely. Hemoglobin grabs the oxygen in the lungs and ferries it around. Lose the cells, lose the hemoglobin, and your body's oxygen delivery capacity just plummets.
Which leads to tissues not getting enough oxygen.
Hypoxia.
Exactly. Tissue
Yeah.
hypoxia. And that's dangerous, obviously. Cells need that oxygen to function.
Okay, so that's the problem. Not enough oxygen delivery trucks, the red blood cells.
Yeah.
So how does putting someone in a high-pressure oxygen tank, which is HBOT, help? It still feels like the trucks are missing.
Ah, but that's the clever part. See, HBOT isn't just more oxygen, it's oxygen under pressure. Usually 100% oxygen at pressures higher than sea level.
Right.
And that increased pressure does something remarkable. It forces way more oxygen to dissolve directly into the blood plasma, the liquid part of the blood.
Oh, okay, so not just relying on the hemoglobin in the red cells.
Exactly. Normally, plasma carries very little dissolved O2. But under HBOT conditions, the amount goes way, way up. It becomes a significant oxygen transport method all on its own, independent of hemoglobin levels. So even with fewer red blood cells, you're essentially supersaturating the blood liquid itself with oxygen.
You got it. It's a way to potentially compensate, at least temporarily, for that lack of red blood cell oxygen carrying capacity.
Okay, right. So the analogy, it's like if the delivery trucks are scarce, you dissolve the packages directly into the river flowing through the city instead.
That's actually a pretty good way to think about it, yeah. The plasma becomes a much more effective oxygen carrier under pressure.
So with all this extra oxygen dissolved in the plasma, what are the potential benefits for someone who's just lost a lot of blood?
Well, thinking about how HBOT works for other hypoxic conditions, we can kind of map out the possibilities. The biggest one, the most obvious, is just getting more oxygen to the tissues.
Even without the red blood cells doing all the heavy lifting.
Yes. That high partial pressure of oxygen created in the chamber helps drive oxygen from the plasma into the tissues that are desperate for it. That hyperbaric medicine handbook actually mentions that tissues don't always get fully oxygenated even normally.
Interesting.
So HBOT can push past some of those normal limitations, forcing oxygen in. That could be absolutely crucial in fighting off the hypoxia from major blood loss.
So you're sort of pressure washing the oxygen into the cells almost? What else? Does it help the cells themselves beyond just getting oxygen?
Well, yeah, oxygen is fundamental for energy production, right? Cellular respiration, making ATP. That's what keeps cells running.
Uh-huh.
When oxygen delivery tanks because of blood loss, that whole energy production process gets compromised. Cells are struggling.
So HBOT could give them the fuel they need.
Potentially, yes. By boosting oxygen supply, it might help cells maintain essential functions, maybe even start the repair process. That principles text talks a lot about oxygen and wound healing.
Mostly chronic wounds, though, right?
Mostly chronic, yeah, but the basic principle holds. Cells under stress need oxygen to function and fix things. Giving them more could really help, even in an acute situation like this.
Okay, so it's not just keeping things going, but maybe helping the body start to recover, too. You mentioned microcirculation earlier. Something about tiny blood vessels.
Right, that's another interesting angle. The handbook notes that hyperoxia, that high oxygen level, can have, well, complex effects on blood vessels. Larger ones might tighten up a bit.
Okay.
But in the really small ones, the capillaries and those tiny arterioles, it might actually improve flow, or what they call shunted output. These are the vessels right down in the tissues where the oxygen exchange happens.
So it might help get the oxygen, even the dissolved oxygen, delivered more effectively right where it's needed most, at that very local level.
That's a potential, yeah. Improving delivery at the capillary level could make a big difference in actually oxygenating the tissue, even if it's mainly dissolved O2 getting there.
Okay, this is starting to paint a picture. More dissolved oxygen, better push into tissues, support for cell energy and repair, maybe even better micro-level delivery. It really sounds like it could be useful in certain emergencies. What kind of situations are we thinking about?
Based on these mechanisms, you can imagine a few sort of hypothetical scenarios. Think about severe trauma, like a really bad car crash with massive bleeding.
Right. Where getting blood transfusions might take time.
Exactly. Or maybe the initial amount of blood available isn't quite enough to stabilize things quickly. In that kind of situation, HBOT could, theoretically, act as a bridge.
A bridge.
Yeah, a temporizing measure. Buying time by boosting oxygen delivery to the vital organ's brain, heart, while the trauma team works on stopping the bleeding and getting blood products in.
That makes a lot of sense. Provide that critical oxygen support during those really unstable early moments. What about, say, after surgery?
And that's another possibility. Imagine major surgery, and then the patient has significant postoperative bleeding. If they're already quite fragile or hemodynamically unstable,
Yeah.
HBOT could potentially support tissue oxygenation during that recovery period, help prevent complications from hypoxia while their body works to replace the lost blood cells, especially if getting their blood count back up quickly is proving difficult.
So it seems like the niche might be in these really severe critical situations where standard treatments need a helping hand with oxygen delivery. But obviously, HBOT isn't magic. It's complicated, right?
Yeah.
What are the catches, the limitations?
Oh, absolutely. Huge considerations. First up is safety. You're dealing with a 100% oxygen environment under pressure. That means fire risk is a major concern.
Right. I saw the European code mentions that Annex 7, I think. Strict rules about what goes in the chamber.
Exactly. Very strict protocols.
Right.
No static, no prohibited materials, careful handling of anything electrical. Safety is paramount because of that oxygen-rich atmosphere.
Makes sense. It's not your average hospital room.
Not at all. And then there's the logistics. You need a specialized hyperbaric facility.
Yeah.
You need trained staff. That European code actually lays out minimum staffing for, say, a multi-place chamber. You need the doctor, an attendant inside with the patient, an operator outside running the controls.
So it's resource intensive, not something you can just decide to do in any emergency room.
Definitely not. Availability is a limiting factor. And maybe the most important point, scientifically speaking.
Yeah.
The sources we've looked at, they lay out the rationale, the principles. They don't actually contain clinical trial data, specifically showing HBOT works for acute blood loss anemia.
Ah, so this is based on how it works in other low oxygen states, but not proven for this specific condition.
Precisely. The potential benefits we've discussed, they're based on understanding the physiology. We need dedicated research, clinical studies to really know if it's effective and safe for this particular use.
That's a critical caveat. And are there side effects to HBOT itself?
Yes, there can be.
Right.
The most common relate to the pressure changes barotrauma, like problems with ears or sinuses clearing the pressure. The code calls them dysbaric injuries. Usually manageable, but definitely a factor.
Okay. So, summing up. Potential benefits in really specific life-threatening blood loss scenarios due to boosting dissolved oxygen, but balanced against major safety needs, logistical hurdles, and crucially, a current lack of direct clinical evidence for this application.
That sums it up pretty well. It's a compelling idea based on the science, but still needs rigorous investigation.
Well, this has been really insightful. Diving into how HBOT, something usually for different problems, might offer this unique support when the body is suddenly short on red blood cells. It's fascinating how that core mechanism increasing dissolved oxygen could be leveraged.
It really is. That ability to bypass, to some extent, the reliance on hemoglobin by saturating the plasma with oxygen under pressure is, well, it's the key idea here.
So for you listening, here's a thought to chew on. We know oxygen is fundamental for life, instantly critical. Could HBOT, with this power to super-oxygenate the blood liquid itself, maybe become a more seriously considered tool in a wider range of emergencies where oxygen delivery is acutely compromised, beyond just the conditions it's used for now?
It certainly opens up questions about its potential, doesn't it? And highlights the need for that research to see where this technology could really make a difference in critical care.
Definitely food for thought. Thanks for taking this deep dive with us.